So good afternoon, everyone. Welcome to our weekly session. I'm happy to open the session. So Professor Francesca will lead the session. With that, I would like to give the floor to Professor Francesca. Professor Francesca, would you like to put agenda in the chat box, or do you have it in your laptop?
I have it here, but then I think it's okay to also put it in the chat box for everyone to follow.
Okay.
Once you get it. Yes. Do you have it handy, or do you want me to put it?
So I'm already putting it. Yeah.
Right. Thank you very much, Aliyah, and good afternoon, everyone. It's nice to have you all here again today for our regular Tuesday meeting. I would like to welcome every member of our community. Do we have any new person who is joining us for the first time today? I'm going through the participants list. No new person yet, but in case there is a new person, the country coordinators should kindly let us know, so we warmly welcome them as is the usual practice. We have a fully packed agenda today, but we hope to be able to run through things quickly such that we don't have to keep anyone beyond the usual 1 hour. The first item will take update on finances. Frederick Obwanda, is Frederick on the call? I don't see Frederick on the call yet, but I can provide a quick update that some of the contracts have been sent out and some have come in, so we expect the payments to start coming in any moment from now. And there is also a new change due to certain changes in policy. Originally, VODAN Africa has been bearing the cost of bank charges to beneficiaries of the payment. But due to new requirements now, the board has approved that the charges will have to, the receivers will have to bear the charges. It's not much anyway, so but I hope that the members of the community will demonstrate understanding on this and bear with us. There are new tax laws in Europe, and then our funders too, the funds don't come in at once, they come in tranches. So we need to fulfill those conditions to make sure that everybody gets paid. Then for the country implementation.
Professor, your voice is coming from far away. Can you, there is something with your mic.
Right, sorry about that. I'll just do that. It's because of where I'm sitting. I apologize because of where I'm sitting to run away from the noise of the storm. But I think, is it better now, Aliyah?
Yeah, that's better.
Okay, thank you, and apologize for that again. So then for the countries, the financing will be up to the tune of 1,000 euro for computers and internet in each of the health facilities. And this will be implemented country-wise. So the country coordinators, we had considered making a central purchase. But then when we consider the cost of making the purchase and shipping the computers to the countries and the partner health facilities, it's going to be more expensive, and then dig into the original budget for the countries. So the budgeting for the financing of the computers is for 1,000 euro as the budgeting for a computer for each health facility. We hope that with this, we'll be able to get a system with optimal performance. And of course, the systems will only load the VODAN Africa application. It will not be used for anything else. So it's going to form part of the agreement with the health facility. On fundraising, we are partnering with the Stanford University to respond to the NIH call from the United States government. And then there is the EU call that is being led by Miriam. So members of the community may be invited to contribute to these proposals, but we're actively working under the leadership of Professor Brian Rising to ensure that we have funding for the next phase of the project. For the current phase, we're still enjoying funding from Google and the FMO, and I'm preparing the final report for up to May 31st so that we can request the next tranche of the funding from the FMO. Those are the updates on finances and fundraising. Perhaps if Frederick joins later, he may be able to provide a fuller update because he's in charge of the management of our finances. And Professor Miriam, in case she joins later, she might also provide additional information on the fundraising activities on both the EU call for proposal and the NIH call in partnership with Stanford University. I would like to use this opportunity to request from the members of our VODAN Africa network, if you know any institution, or whether private or public, that has benefited from the NIH funding in Africa on data science or health data, please let me or Professor Mariam or any of the country coordinators know this, because we're also actively looking for partners in African countries who are familiar with the NIH funding system and who we can join forces with to strengthen our application. Thank you. I will quickly go to the third update, Aliyah, if you allow me, on the team development, team on deployment. We have not been able to reach our colleagues due to the situation in the Tigray region of Ethiopia. We have not been able to communicate actively with Getu and Samson. And of course, you know, they're actively leading the technical deployment aspects of our projects. So yesterday at the meeting of the country coordinators with the chairman of the implementation network, the VC of KIU, and then some other members of our community, it was agreed that we form a technical team comprising of Oluwole, Aliyah, Miriam, Rudwan, Nambobi, and Tigist to take the last updates from Getu and Samson and see how we can locally deploy Cedar on a PC. So if we're able to do that, what Samson and Getu they have done, then we can now contact the team of Cedar and see if they can assist with the Dockerization. So Aliyah, I would like to request that you set up a meeting of this team, of everyone in this team, ASAP. You're very key to this because you have been our bridge, the project's bridge with Getu and Samson especially, you and of course Rudwan, so that we can look at where they stop and whatever work products or work package we have received from them, we can improve on that, if any. If not, based on the discussions, we can follow their footpath and see how we can remain within our timeline. Because now we're in July, we are running out of time and we need to fulfill this, this milestone to the satisfaction of the sponsors. Otherwise, we may run into some scheduling problems. So that was the agreement yesterday, and I will be coordinating the team with the help of Aliyah, who will be doing the technical coordination, and Oluwole. I have not seen him on the call, but I had a pre-meeting with him yesterday to prepare his mind. However, due to the online exams, oh, excellent. Thank you, Oluwole. I know you're busy with the online exams at KIU, but thank you very much for being here. So if it is possible for us to meet immediately after this, briefly, so we understand what we are required to do and how we go about it, that would be very nice. Otherwise, we can schedule another meeting for later tonight. But Aliyah, your time zone would matter. So I will leave you to be the one to schedule the meeting. Those are the updates from me for now. Samson and Getu, we have not been able to communicate with them. The internet and electricity has been shut down in Mekelle. And we didn't know this prior to now. We could have arranged to get them out of Mekelle like we did the last time. And they cannot even go out of Mekelle as it is because all road, rail, and air transportation also are affected by the kind of lockdown in Mekele. But we continue to keep them in our thoughts and prayers and continue to hope through the other networks that the situation in Mekele will be brought under control so our people can rejoin us soon as possible. Thank you, Aliyah. Those are the updates from me. We'll take the next one, which is a presentation on health information systems by Yilin. Yi. Hello, Yi. Will you be ready to make your presentation now? Right.
Simple random strategy procedures.
Is Yi on the call? I can see her on the call.
He's on the call, but I don't know, he's not responding. There is something
Okay.
with him.
Yes, I can see him. All right, then let's take the next presentation. I will come back to you. I'll send the message on WhatsApp. So we'll take your update, Aliyah, on health facilities communication. Sorry, on information architecture by Aliyah. Let me private chat you.
Shall I start?
Yes, Aliyah, go ahead, please.
Okay. So let me start from the beginning. So basically, this is going to be the presentation about information architecture. Yesterday we had also this presentation, but since it was very narrow team and based on Cedar localization, so today I'm going to do the same presentation, but with a brief summary. So there are three levels of data that we would like to have in VODAN. So the first one is health facility data, which contains information on health facility itself, such as health facility ID, name, region, number, and this kind of information. And the second level is going to be based on patient's data itself. So the key point is here patient ID, then gender, date of birth, ethnicity, and this kind of information. So the third level of information is health info. So there are two key fields, which is diagnosis and the service date. So basically, in order to trace what kind of disease and also when the service is received by patient. So let me deeply explain these levels. So health facility level. The key information is here health facility ID. So yesterday I proposed to launch VODAN MFL code. So it's basically VODAN master facility list code, which will store unique IDs of health facilities. And it could be inspired by WHO's MFL code, the standard identifier for health facilities. And the goal is here to uniquely identify health facilities. So an example of VODAN MFL code can be this one. So like first letters of the country and then the number of the numbering. So then the second level is going to be patient data level. The key point is here patient ID. So and then yesterday we have discussed the possible ways to generate patient IDs, and we agreed that making generating patient ID using health facility MFL code, which is unique also, and then also national ID number of the patient. So this will help us to do analytics based on individuals, not only like health facilities itself, but also to do some statistics and summary based on individuals. So, and then there are three ways to enter patient into Cedar. So, for instance, in the case of OPD, we can enter it manually into Cedar. So, but for that we have to look up patient ID in the external system, or it can be paper book. It also depends what kind of system hospital uses. So basically, look up patient ID from the system and then enter it manually to Cedar. We kind of agreed to have this option for the MVP since it's easy to deploy and it doesn't require some extra resources and the technical customization. When we go, so we can apply more advanced levels of entering patient ID. So it can be, for instance, connection between Cedar and patient ID system, or it can be Cedar generated patient IDs. So we can include like the system inside Cedar, like lookup widget that can find patient ID in Cedar. But this is something that requires resources and customized development work. So the first option is kind of suitable and also more reliable in terms of time for our goals. Going on the third level of information architecture, so it's going to be health info level. And the key point is here diagnosis. So we also agreed that we'll have the VODAN disease code. So it's like standard way of listing diseases. For that, there are 3 people in the team that will be working on it, who will issue the list of codes based like joint diseases list code from Ethiopia and Uganda, which is complies to WHO's ICD-10 code. So basically it's going to be WHO's ICD-10 codes, but it's not going to be the entire ICD-10 code. It's going to be just diseases, joint diseases from Ethiopia and the Uganda's diseases list. So this is good as the starting way. So, but as we go further, we can also apply more standardized way of listing diseases. So this is basically it. If you have any suggestions or any inputs, please feel free to share your recommendations and inputs, or you can type it in the chat box. So that's it from my side.
Thank you very much, Alia, for the excellent presentation. If there are questions, I'll be looking to see if there are any hands up. But I have a question of my own, and I'm wondering, these different levels of information, shall we set a standard for VODAN, or we have to adopt the standard that is in use in the implementation country?
I think we can set as VODAN. So I mean, like even the diseases code is not going to be for each country. So it's going to be, for instance, VODAN diseases code, VODAN MFL code, like master facility list. So, and then each facility will have unique IDs. And then, for instance, even the patient ID will be based on VODAN MFL code plus national patient ID. Does it answer to your question, Prof?
Right, thank you. I see Gudrun agrees with you and says standardizing through VODAN, utilizing international standards will be a really large advantage. Countries themselves can still use their own naming or label. Excellent. Thank you, VODAN. Are there questions? And the country coordinators and technical leads, I hope they're taking notes on this especially. I'm looking through, I don't see any hands up. Are there questions or contributions on this? Dr. Wondimo, you have had experiences with the Ethiopian system. What is your take on this?
Thank you, Prof. I think it's possible to use this approach, and we do have a national disease classification code, which is adopted from the WHO International Code of 11. So I think, for my view, I think it's possible to use this one.
Right. Thank you very much, Dr. Windimu, because I know you have had experiences with similar things like this, so you can be able to advise us if it's something that can be adopted and acceptable to the different health authorities in the countries, which I think should be possible. Thank you. The presentation by Yilin will be next week. So Alia and Putu, if you like, please, you can note this. The presentation on the health information systems, the comparison, will be by next week, Tuesday, at our next week's meeting. So you could please note this to put on the agenda. Thank you.
Prof, just one more note, one more consideration to add. So basically, we are trying to comply with WHO's standards, like even MFL code is something that WHO recommends, and also International Code Disease is something that also WHO recommends. So I think complying to these standards as VODAN community also help us like to be in international arena, and also set some standardized way of listing diseases and hospitals, and it's like this kind of information.
Right, this is excellent. Thank you, Alia. Another question is, so are we we have to agree on this then at the level of our projects before the deployment and the continued use of the system in the different health facilities? When do you think we might be able to come up with our own standardized codes? I know you have suggested some. I remember when we had the FDPs, we were using the prefix FDP and then followed by the serial number. That was what we did for the FDPs in the first phase of the project. So I don't know when you think we might have this. So as we're listing an inventory of the health facilities, we should now be listing them, in addition to the name and addresses, we should be listing them with the MFL codes.
So I think can be ready like in about 1 or 2 weeks. I mean, the MFL code could be done as soon as possible, but the disease code is something that requires some work. So I think the disease code will take like around 2 weeks. So I would say 2 weeks from now.
Okay, thank you. And who do you need to work with? The country coordinators or the technical leads for the countries? Who would you need to work with? Standardized. Of course, VODAN automatically should be there.
Yeah, we also started some yesterday we have chosen 3 people on the call in Cedar localization meeting. So it's Nambobi and Seth, and also Zohra, who will be helping the to creating a standardized way of diseases code. So hopefully will be that will be ready in 2 weeks. Yeah.
Okay. Thank you, Alia. For the country team, do you have the list of the health facilities? Now you have the updated list, because at yesterday's meeting we had 82. I think Miriam can remind me. Do you have the complete list for the countries? There are 31 in Ethiopia, 21 in Nigeria, I think, and where else? Uganda, Tanzania, Liberia, Zimbabwe. I think it would be good to get the updated list of all the facilities for the countries.
Yeah.
Maybe you can just do an email to the country coordinators and put me and Professor Miriam in copy so we can follow up as well to make sure that the list of health facilities, and when requesting, you could give a template on the kind of information you want about the health facility. So we can have that, and then we could have a Google sheet, which will now be permanent, kind of. And if there is need for updates, that can be done on the sheet. I know we had an initial one, but many of the names on those health facilities are we're no longer deploying in those places, and new ones are coming. So perhaps it's good to have a clean sheet now of all the information required on the health facilities. And there could be a space for the facility code, which we can insert as we find appropriate.
Okay, Prof.
Thank you very much, Aliyah. The next update is still from you, but before that, I have a very important announcement to make. 1 minute, Malam Karu, the government of Niger State, the Ministry of Health, has given approval. I know that should come under country reports, but it's a big one for us. We received a huge endorsement, and the government of Niger State, through the Ministry of Health, has given approval for the project to be implemented in the health facilities. So this is a big win for us, and I'm already preparing a communication to our sponsors to let them know that we have received an additional endorsement, apart from the ones that we have received from some other countries like Ethiopia and Uganda and Zimbabwe. I thought to make that announcement. Yes, Mr. Kawu, you wanted to make a contribution?
Oh, okay. Sorry. Thank you very much. Not really. It's just to say to add to what you say, what you mentioned about the endorsement. We've received from the Ministry of Health now endorsement to access the facilities for the purpose of this project. Earlier on, access to facilities was very difficult, especially public health institutions. But with this now, we are able to easily, or the data stewards are able to easily access the facilities and engage them in the rounds of communications that are some of the activities at this stage. So yes, thank you very much, Prof.
Yes, I would really like to thank you, Team Nigeria, and congratulate you on this excellent achievement. I know you have put in so much work, you have made a lot of travels, and congratulations because your efforts have paid off. Thank you very much, Malam Kawu, and congratulations to you, Dr. Abdullahi, Ibrahim, Dr. Sakinat, Dr. Bashir, and every member of the Nigerian team, and especially the member of the IDB on template creation. Hello. Yes, Aliyah, you're on mute.
Yes, sorry, there was a question, so I think I missed it.
Yes, I was just taking the updates. The next update is from you on template creation.
Oh, yeah. So basically, the OPD templates are ready. And there are some still ongoing work on maternal health records from Ethiopia and Somalia. So, and the vocabularies are being created, and there is an issues with there is an issue with vocabulary in Bioportal, which is being resolved with John now. So otherwise, everything is in place and in order.
Thank you, Alia. Would you also like to provide an update on the certification process for the data stewards, as was discussed with John? And what is the idea behind the certification? What would they need to do? And who will provide the certification?
Oh, Prof, that's something we haven't discussed yet. So I think we need to first decide, and then I can make an update on it.
Okay.
But yeah, definitely there is going to be certification process of data stewards. But before that, we're going to give more advanced level on vocabulary creation. So, and then after that, we can make the certification.
Right. Thank you very much, Alia. Thank you for the update and a good job. Congratulations to you and your team for everything you have achieved so far on the templates and vocabularies creation. And the next updates will come from Rujuan on the team of dashboard creation. Rujuan, please.
Yes, sorry. 1 moment. I'll get to share. That's disabled screen sharing. I don't know what.
Okay, right.
Okay, thank you. 1 moment. Okay, I can just show you a bit about Cedar. I just made some example data and the way we query that right now. I still have discussed with John what the most efficient way is. The way we query now, you first go to search. So that's just a general search of all the templates. So you can type here template. And then you can run that command. You can use the curl tool, or this is of course just the get, so the REST API. Then you get a list of all the different templates that are in the system and are available to you. So I can search the one I made, a name. So this is all the metadata. This is the full provenance, so the versioning. PFA means provenance version author. You can see who it's owned by. So this is my user ID, who it's created by, etc. So then you go to ID. This is my template. So now I can query for the template itself. Example like this. To get all the different information, like the fields that are stored. You can see here the provenance data. And if we go down here, we can see the different fields. Let me see. It's over. Yeah, it should be over here. Yeah, here. So these are just, for example, the different metadata that we made. So I just name, date of birth, sample visit. Or just some examples. So what we can do now, we can keep this this template, and we can look up the instances of that template. So what we do, we look at the instances that are based on this template. And this is a way we can get all the, for example, in my case, I just made an example of patients. So this will give the RDF of all the patients. So it also says who entered this data, when it was created, who it was created by, which was last modified by. So this is the full provenance. And this is the actual ID of that data. For example, we take this template instance. And what we do now, we simply open this instance with get command using that link. One moment, I think I entered the wrong one. You see. Oh, that was the wrong one. Okay. So I took the template instead of the instance. So the ID is the instance. So you just enter that. And now we get the full RDF of that instance based on a template. So this is the templated instance. Now we can get this, of course, the provenance data. And here we get the actual data. For example, this person's name is James Doe. Date of birth is this. And it says also the type. So this is the RDF type, just standard date type. This, for example, some sample value, decimal type. And this is a binary value, first visit. So there's no value here. So that's not his first visit. And otherwise, that would give you value like that it exists, a Boolean. So this is the way that the data is stored and the way it's retrieved. And we're getting it this way. So the next step is also to kind of combine different data sources. I mean, this is all working. We also tried it before with Samsung. And the APIs are all working flawlessly. So just need to combine it together and then get it into the dashboard. That should not be too difficult. The main things we will be running into is mainly the technical components on site. And of course, the choices we have to make in terms of templates. Like we have to think what works best. And Aliyah already made a lot of work in that. So that's so far how far we are. And if there's any questions, just let me know.
Thank you, Rudran. Let me see if there are questions. Yes, Abdullah Kawu has a question. Mr. Kawu, please.
Okay, yeah, thank you, Rudan. I was just thinking, yes, those are REST API. Is this like the first stage of the work? Because I was expecting to see like the visualize part of the system, like the
This is just the first part. So we will integrate this into the dashboard.
Okay.
We're really testing out the Cedar, kind of the reading of the data, querying of the data.
Okay. Thanks.
Thank you, Rudran. I was about to ask the same question because I was expecting to see visualization in terms of graphs or charts or something. So let's see. And then thank you for the good job, Rudran, by the way. But I could see things about name and date of birth or something. Are those going to be visible as well? Because we are talking about health data. And I am not sure if Putu is here.
No, this is just the underlying system. So these won't be revealed in any visualization. But this is just the perspective of the data steward. You can enter these data, query this data, and this will then be transferred to a component. It'll visualize it.
Excellent, excellent. Thank you very much, Rudran. Thank you. Okay, we're still within time, but we'd like to take updates from the country coordinators. I already gave an update on the meeting of yesterday. Because of the situation in Ethiopia, we had to take a decision, which has now given rise to the team on deployment, consisting of Wole, Aliyah, Miriam, Rudran, Nambobi, and Tigis. And we're hoping that we can take over from where Samson and Getu stopped. Also, we looked at the finances and we agreed on the budgeting of the computers and the hospital data stewards. So for each deployment, we have agreed on €1,000 as the cost of computers and the internet for each health facility. and 600 euro as a ceiling, the maximum for the data steward in the health facility. That was the agreement of the country coordinators yesterday, and we are requesting for the funds from the funders. I'm going to be making the request shortly after this, but for the members of our community, the funding for the data stewards who have completed their contracts should be going on any moment from now. I think I saw Frederick came in the meeting, so perhaps Frederick will be the first to give an update before we take the country coordinators to give an update on the financing and the contracting. Frederick? All right, so I guess our private chat, Frederick.
Yeah, here I am. Here I am. Yes. Ideally, I've based on the fact that the last couple of weeks, yes, we've worked on the budget lines and the contracts are ready. But then I think there's a small adjustment that I just need to make on one of the clauses. Then I think it moves to basically the payment side, which is it's all clear for now. But so far so good. On from my end, a small adjustment that I need to make, and then we'll be okay.
Right. Thank you very much, Patrick. Thank you. So we're hoping that before the end of this week, some people with their banks should be able to receive their payments. I know usually once it gets to the admin for payment, they don't waste time. So we should also speed up on our own part so that we can be sure of a seamless participation by members of our community. Thank you. I would go on to Ethiopia, Dr. Wondimu, if we can just get a brief update on the country.
Thank you, Prof. From our side, already the second communication is all health facilities communicated for the second communication. Besides this, we have also provide overview for the all health facility management because we had a workshop for other project, and then we try to use those opportunity to brief the management of health facility about the upcoming Cedar project. So this is a brief update from our side. Thank you.
Thank you very much, Dr. Wondimun. Next, we'll go to Somalia from update from Din Jamal. Dr. Jamal. I think Dr. Jamal has dropped off from the call. If he joins us before the end of the meeting, we'll take the update, but I also know that the project is ongoing in Somalia, and then they are still maintaining the number of health facilities. Additionally, Somalia will be implementing the Computer Science Course 3 under the NUFIC VODAN Africa Cooperation that I can give us updates from Somalia. We'll take update from Kenya, Dr. Reginald.
Yeah, thank you, Professor. The meetings with the health facility directors is ongoing, and we created a WhatsApp group so that we can communicate. In the same group, we have the data stewards who are following what we are discussing. And I thank the team led by William for facilitating that. Then we have just been discussing that having gone through VODAN almost a year, we need to create some kind of a training manual. In fact, I'm just discussing on the side with Wondim, so that if I go to a health facility and the director is asking me, oh, tell me something about VODAN. So what should I present that is precise, that if Professor Francisca comes in, she's saying the same, Professor Miriam, Alia, Putu, so that we're on the same language. I think it's something we need to see how to go about it. And very lastly, that the Minister of Health is very keen to see how we progress, then give them a presentation, and then they be continually working with us. That's what I would say. Thank you, Professor.
Thank you, Dr. Reginald. There is an information sheet that Obina had made and we had circulated earlier. I guess I can recirculate that. Please, if you shoot me a WhatsApp after this meeting, I can recirculate that for you. That contains all the information about the project. So that will be it kind of simplified things. And everyone, you don't need knowledge of computing or IT or technology to understand it. It spells it out in pure layman's deployment language. So I will reshare that with you again, either by WhatsApp or email or by both. Thank you. I see Professor Bernard from Zimbabwe earlier. I don't know if he's still on the call. Professor Bernard, I don't see on the call. Perhaps he dropped out due to network, or if he joins again, we'll be able to take updates. Additionally, I don't see Dr. Jeremiah on this call. So I'll call on Dr. Sakinat for Nigeria. If Dr. Sakinat is not on the call, then Malam Abdullahi Kawu, can you please, you're the technical coordinator for Nigeria, perhaps to provide an update in addition to what we already announced on the approval by the Ministry of Health in Niger State.
Okay, I think Dr. Ibrahim is on the call. He can give us updates.
All right, Dr. Abdullahi, my apologies. I was scrolling through and I think I'm missing. Yes, Ibrahim Abdullahi. Dr. Abdullahi, please.
Yeah, hello and good afternoon from Nigeria. From Nigeria, just as Prof. Francisca and Professor Miriam and other partners are aware, we were able to get the official introductory letter that will make our work seamless and very, very accessible to all the health facilities. And just as Prof. Francisca has mentioned, we are awaiting the final budget and the ideas so that we can create what we have and to make our work maybe generic for the country. From the last call, you will all agree with me that we're also trying to have a unique identification to make the work easy, and so that when we come into reporting, it will be very easy for us to also identify which facility we are reporting for what and for the progresses. And as regards the data stewards, all of our data stewards are out on the field. They have visited the facility and
Dr. Abdullahi, I think we lost his audio.
I think we lost him.
Yes, we lost him.
All right. Oh, you were not hearing me. Maybe can you hear me now?
We can hear you now. Yeah.
Okay, we are almost through on the first round of communicating with the facilities. Can you hear me now? All of our data stewards. Wow, the network is a bit terrible here. Can you hear me now? Or maybe Abdullahi Kawu, can you take over, please?
Okay, no problems. I'll just take it from here. So yes, we have now our data stewards are in the field trying to get information from each facility. This is facilitated by the approval we got from the Ministry of Health. Previously, we are hindered by that approval in approaching our government facilities. But now with the approval, our data steward are able to approach the facilities and communicate with them. We have also planned that from the technical side, that we'll be having at least a monthly meeting with health facilities on progress on this project. This is to kind of standardize engagements with them. So this is thought of either to be virtual or physical at a selected location. Especially because we are approaching implementation where Cedar will be deployed in the facility. So we need to know and engage more formally by having to set aside a day within a month to have feedbacks from deployments or feedback from use of the platform. So this is also planned for the data steward, the VODANA data steward now. We will be having weekly meetings because they will work closely and will be need to first we have a first we have also the certain gaps in knowledge, but I'm very pleased with the development from the Cedar localization led by Aliyah of certifying or recertifying our data stewards. Some of them have just come on board, so we need to bridge that knowledge gap. For some of us that have been there for too long, we'll support, but I think this certification is a good step in the right direction to really get the, I will expect there are some tasks and responsibility before they get truly certified. So for us, it's quite good to really recertify or certify our, across regions anyway, across countries, data stewards on this project. So nevertheless, we'll be meeting weekly to get feedback on the communications they will be having from the facilities, from which we can take action points going forward for every week. So that is what is planned. Then quarterly, we also want to engage the Ministry of Health to give them also some feedback on the process, because as you can see, they've sought to also get some feedback at interim or at intervals, just so they know what is going on in the facility. So we also think of this to be physical mostly, but if virtual permits, yes, we'll do. I think not to take much of our time, this is the much we have been doing from the Nigerian end, and a lot is being planned going forward, taking all the feedback from this meeting, Cedar localization meeting and other meetings, access control meetings. And yeah, we are realigning our strategies towards reaching the goal of the project. Thank you.
Thank you, Mr. Kawu. Thank you for the update. Before we take the questions and AOB and close, I would like to invite Putu to please give an update on the communications with the health facilities in the countries. Putu, please.
Yes, thank you, Professor Francisca. Yesterday we had a meeting, but we are hugely discussed about what happened in the health facilities. What happened? What is the condition of health facilities based on our questionnaire? And yesterday, three countries were present. It is Nigeria, Ethiopia, and Somalia. And about Yilin's presentation, so Alia, Lin, and I will summarize the finding about hospital information system, and also Lin will compare the health information system in will do a comparison between health facility system in Africa. And also this is really important, Professor Francisca, because last week Professor Miriam shared about ICT adoption in sub-Sahara Africa. So what is our purpose in the meeting is to avoid like a negative consequence, because our purpose is to apply new ICT, but sometimes they are not like another problem will emerge. For example, like I found that in Nigeria there is like they are using paper management. So let's see if there is another problem emerge from that, because you know that like if will be there is another problem if we convert it to digital. So maybe we'll So we want to avoid that kind of problem. So this the questionnaire is really important to know the situation. And the last update about Professor Francisca, I need your help for the agreement of health facilities and VODAN Africa. So Frederick and I create the agreement. It is a content of 3 pages, and the last pages is about term and condition, and the last article is about collaboration. So I don't want to I want to make more detail about the collaboration between VODAN Africa and health facilities. So that's why I think I will send the draft to you, and maybe you can give me input. You can give me input about what else can we put on the last article. Yeah, Frederick helped me about the agreement. So we'll just we almost finished the agreement, but I still doubt about the last article of agreement, Professor Francisco. So that's all from me, Prof.
Oh, excellent. Thank you, Putu. Yes, I can help again. And I can also send it to Simon. Simon usually provides assistance to us and guidance on things of agreements. Simon has been of a lot of help in most of the agreements we have had to sign, even with Cedar and some other people. So I can also run it by Simon. Thank you very much, Putu, for the updates. We are already 3 minutes way over time. Are there comments or questions? We're now in AOB. I see Amit Mishra from Nigeria. Dr. Abdullahi or Karu, can we have anyone introduce Amit? Has it been introduced? Or Amit, would you like to introduce yourself, please? All right. That's excellent. It would be nice if you could just introduce him to the members of our community. Dr. Abdullahi. Or Mr. Kawu, one of you can introduce him. That would be fine.
Hello, Prof. Francisca. Can you
Yes,
hear
I
me?
was asking to introduce Amit Mishra.
Yes, Amit Mishra is also a technical support and IBB University Extension. He has been part of our strong software engineers in the Department of Computer Science. So we brought him in so that he can understand. Right from the point of FDP deployment, he has been with us in the background. Thank you so much, Prof.
That's excellent. We warmly welcome Amit, and then we hope that we'll get more of those technical support from him, even across the other health facilities in Nigeria beyond IBBUL. Thank you very much, Doctor. Right. So we're 5 minutes over time. I would like to thank everyone again for your patience and participation at today's meeting. And Kawu, yes.
Yes, just to, Putu made mention of his finding from Nigeria. And I was just thinking around that first, yes, they use paper and pen, but sometimes they are able to enter data. So there may not be much problems to the HIS because they have DHIS in most of they enter data on DHIS. But rather than enter data daily, as may be required from Cedar platform, they usually enter data monthly and maybe on their mobile phones for the most times. Right. Because, but by the design of Cedar and from the point of OPD registers, then data should be entered daily, right? So, so it's a different scenario, but then right. That they are familiar with use a problem, more so that they are VODAN stewards that will be supporting. So just to put that clearly.
Okay. Thank you very much, Malam Kawu. And thanks to everyone again for joining us. I wish you all the very best for the rest of the day, and goodbye. Thank you, Aliyah and Kutu, for putting this together every Tuesday, and to everyone who provides one form of support or the other. I'll say thank you as well, and congratulations on some of our little wins. I hope that we'll be able to have our big celebration come October. Bye, everyone.
Thank you, Prof. Bye, everyone.
Bye.
Bye. Have a nice
everyone.
day.
Thank you, Amelia. Thank you, Prof. Bye, everyone. Thank you.